Hello, everybody. This is Anne de Gist, and this is Friday, August the 7th. And this is the first video about what's happening with the COVID in the world. And we're going to focus today on epidemiology. Please make sure you see the second video on clinical. We have a lot of information this week. And I highly recommend that you share it with your network. So today, let's look about how the virus is spreading in the world. A lot of people have been asking who I was, and so I put this slide there. I'm not a doctor, but I've been working in healthcare for the last 35 years, heavily launching a lot of products, including pulse oximetry, which people are very familiar with right now with COVID, which measure the percent of oxygen in your arterial blood, but also heavily in other patient monitoring in the ICU, in anesthesia, in drug dispensing, and so really heavy. Also, I've been involved investing in company for the last 30 years, and including 40 health tech innovation companies. So I have a deep healthcare business background. Let's take a look at what's happening in the world. And I guess I forgot to update the top slide. It's 8.7, epidemiology. And kind of good news, bad news. We have to see what's going on. The US cases have dropped by 9%. So that looked promising, but the US death rate has increased by 24% and has been averaging over thousands per day. We have a lower amount of testing. So the question is that is the amount of cases dropped because we have lower testing? And there's a huge problem in California, for example, when there's a massive backlog of the number of data. And so we have to see how reliable the data is. So on the bad news side, look here. You can see India, Brazil, and America are all fighting for the number one position, unfortunately, in the number of cases per day. And you can see India is going straight up. So we'll talk a little bit more about that. And we'll talk a little bit about the second wave. In the part two, which is a separate video, we're going to spend a lot of time on reviewing the symptoms. There's a lot of new information on that. Infectiousness and transmission, several slides on the latest data on, when are you contagious, who is contagious, how you can be infected, and also more and more information on this long-term damage that's emerging to be a bigger problem than mortality, and some new treatment that have emerged. So let's do the deep dive. You can see there's really 3 countries in the world that are leading the charge. On a worldwide basis, we are now at 19 million cases. And what is stunning is that we're doing 2 million new cases per week. That is a huge amount of cases. It's kind of mind-boggling there. And you can see on the positive cases there, on the daily cases, there is no slowdown on a worldwide basis. Let's take a look in a deeper dive. India has now passed today the US in the number of new cases at 62,000 cases. The US is reporting 60,000, which is a bit lower than what it was at the peak. If you remember, at the peak a couple of weeks ago, it was around 70,000. But again, remember, we have these data collection issues. And when we shifted from CDC collecting the data around July 15, you can see that there may be some data communication issues. So we need to keep an eye on, see the trend is really going the right direction. Brazil is doing a bit of a plateau, but the data is also zigzagging a lot. But the bad news is India is going straight up. On a worldwide basis, as you would expect, as there's the increase in number of cases, we're now starting to see a rise in the number of deaths in the world. The world case dashboard, India is now on a daily basis, 62,000, number 1 in the world. On a 7-day averages, just because of the data reporting, the US is still number 1, but very close to India, and Brazil is slowing down a little bit there. But if you look at the new cases per million, there's a very high cases in Brazil and Peru. We have 236 cases per million. So it's normalized data there. But the US is not that far behind. So unfortunately, those countries there still have what I will call an outbreak. But look at Chile in the total cases per million there. I mean, Chile is also still having a big problem there. So Chile had a peak there, but it seems to be recovering. Well, if you look at these 3 countries there, we're still pretty much, there's a bit of a downturn in the US, but is this data related or not? We have to probably wait a few more weeks. Try to smooth the curve. So I used to do 1 or 2 day averages. I found another source with 5-day averages of the new cases, just because we have this data reporting that zigzags a lot. And clearly, the hottest places is US, Brazil, and India. That's the one where you see a lot of growth rate. Russia has slowed down, although they still have quite a high number of cases. So US, is it going down or not? So we plateau, but just remember, July 15 is when we made that switch. And so it begs the question, like we're going to see today, California just reported a 300,000 number of cases backlog that hasn't been reported, and the problem in the communication with Quest, who's doing a lot of the cases. So the issues there is that we have other problem in the country there as we made the switch from CDC to HHS, where some of the data give us a false sense that it's going down. And I'm going to show you, we also have decreased by 9% the number of tests we've done in the US. So, and the number of positive rate has gone up a little bit there. So we have to make sure that this is not underreporting as opposed to real cases going down. Brazil, it seems to be leveling a little bit there, but you can see a lot of the data reporting there is clearly showing that we may have to wait a few more weeks to make sure they stabilize. India, there's no doubt it's vertical. And you're going to see that the India penetration is still a small number of their population. So they have a long way to go to control the virus. And they will probably pass Brazil and the US in the coming weeks unless they manage to control this. So we have to keep an eye on India. Mexico, south of the border there, this seems to be plateauing out, so that looks promising there. And so hopefully there's been now several weeks there, you can see a slowdown of the growth of the country there. If we look at the positive test rate, remember the World Health Organization has a target of 5% is the positive test rate. Now, Peru has a 50% positive test rate. Well, what that means is that the only people really get tested are people going to probably to a hospital setting with serious symptoms. So the number of cases they report is totally underrepresented. If we look at India, which is not the same amount of cases, you can see that they're absolutely doing a very low number of tests per 100,000. And India has 8% a positive rate versus US has 7%. So I think it's important to understand when you look at these positive rates is that how does that match versus the percent of the positive rate versus the number of tests done in the population there. So a high number means you're under testing, is pretty much, which means the number of cases underreported. Let's get some reality check. Look at the changes in the last 4 months. This is astonishing. So we had this huge spike in Europe, Italy and Spain kind of really took a really bad hit there. And then North America took over with New York. But look at South America. I mean, it is a big, significant part of our mortality death rate there. But this is the worrisome part. Asia, being led by India, is clearly growing. So you're going to see over the coming months that, these numbers are going to continue to grow. And we're going back to the level pretty close to where we were during the peak of March on a worldwide basis. So that's worrisome because it's still the first wave in most of those countries there. This is not a second wave. It's just the first wave spreading across the world. Looking at death, there was a lot of controversy with the video this week about, what are the claims in the US in mortality rates. I'm going to try to dissect that in different ways to get a different perspective. So there was a high of 1,800 deaths, which is the highest. On the average for the last 7 days, we have been averaging 1,000 deaths per day. And I know these numbers, after a while, we get desensitized. That is a lot of people. It's like a person a minute, pretty much, and that's dying there. If we normalize this, we have 483 deaths per million. And in this group here, which are the top kind of cases in the world, we're number 3 in the world if you look at the mortality on a normalized basis there. Peru, which is a much smaller country, has a higher rate, but you can see they're controlling it. And then Chile, also the higher rate, but they're controlling it. So keep in perspective there, we are basically at the level of Brazil, which is around 1,000 deaths per day. And I think India in the coming weeks will pass this. There is no doubt. So deaths per 100,000, another way to look at this is a confirmed death per confirmed cases. The UK, who for a while did not control the virus, they were trying to follow the Swedish approach, and then 3 to 4 weeks later, they kicked in their restriction there. They unfortunately had a pretty bad hit of 69, around 70 deaths per 100,000 or 700 per 100,000. Then with Peru that we just talked about in Chile, and we are, in that context, one of the worst world in the country. If you're looking at all the countries in the world, US is number 10, but that includes very tiny countries with like less than 1 or 2 million people there. So if you really want to look at big countries there, this is where we look. So we don't really look that great. I mean, we're worse than Brazil and Mexico and Ecuador. So nothing to brag about. Let's take a look at some specifics. On the good news is that the world as a whole is doing a good job at knowing how to treat patients. The mortality rate has dropped from 5%, if you remember, several weeks ago to around 3.3%. And again, this is based on confirmed case versus confirmed mortality. So that does not include all the people who are asymptomatic that we don't know about. Clearly, Italy took the big hit at 14% and Spain at 9%, and Sweden had decided not to control at 7%. So there was clearly a price of not putting restriction in place. And so South America is really in trouble in multiple ways. Not only do they have the pandemic across the continent there, but the GDP has dropped, close to 9%, as expected to drop for over 9% in 2020. Peru could be as high as 14%. They already expect that 20% of the companies will go bankrupt, and that's 2.7 million businesses, and most of them are the small businesses. As a result of that, it is expected that poverty will rise to a total of 230 million people. To give you an idea, in Mexico, they expect to have 57% of the population that will be below the poverty level. That is going to create a lot of instability economically and politically in South America. And they're having a problem there because their debt to GDP has already increased from 57% to 70%. So they don't have a lot of room to basically print more money there. And to give you an idea, you can see the drop in GDP that has happened because of COVID there. And the hope, this is the estimate of what may happen in Q3 and Q4, but these are estimates. So the magnitude is pretty scary there. And so I think this is the concern, that for the last 20 years, these countries have really done a great job in decreasing poverty and enabling a middle class. And unfortunately, these are the ones that are taking the really big hit with those companies going bankrupt. So more data around the world is some serology tests. So if you remember, serology means we look at a whole group of the population, like in a block or city, and then we test everybody. And then we see what's the percent of the population has antibodies, and we compare that to what has been reported. And that will give you some idea of the ratio of true infection to reported cases. Right? So in Italy, that really took the big hit in March, where they show that in the seroprevalence, which is the percent of the population as antibody, as they tested, 60,000 people there, was on the average 2.5%. So if you think about it, the herd immunity needs to be 70%. So even countries like Italy, who really had a big wave, are not getting there. Lombardy, which was the hardest hit, which is in the northern part here, was 7.5%. And there was not a huge difference. It's a little bit higher for the older population there. And pretty much 41% of people got it from an infected person they live with, as opposed to be, in the community there. If you look at the data here, Santa Clara is showing a prevalence around 3.3%. Then you have countries like Germany and New York, or 12 to 14%. These are places where they had outbreaks. But overall, you can see that in Spain, I had also a big hit, was at 5%. Miami-Dade in Florida, which is having that outbreak, is around 6%. So we're still, the virus has a long way to go in being able to spread. Europe really worked. I mean, I know they had a lot of issues and coordination between countries there, but you can see they have a little bit of a comeback. We'll talk more about that. But overall, they have controlled it. Where in the US, we were coming down and we clearly reopened too early there, and you had that first wave that basically exploded there, and hopefully we can control it. So COVID, is it bouncing back? Israel reopened the school, and lessons for us to learn as we're talking about reopening the school. And they had a peak. If you look at Israel, which is the blue part, that was higher than what they had initially in March. So we need to keep an eye on the infection spreading there. You probably heard that Australia, there's a shutdown in Melbourne. Belgium and Holland have a little bit of a peak. But, look at the numbers. They're getting excited when they get 59 cases in the UK. And they're getting, and we have 1,000 cases a day of mortality rate. So it's a very different perspective that we need to keep an eye on. Let's look about the US. Good news, bad news. We have less daily cases, but we have done less testing. And so that's something that you can see. The testing here in the orange has gone down quite a bit, above 10%. And the positive rate, is a bit stable around 7 to 8%, depending on the sources you're using. So the number of cases have gone from a peak of 71,000 on July the 17th to around 60,000 in the last few days there. The number of deaths have gone up. And there was a spike, I think, at 1,800, but that may be data reporting, but it's way above 1,000 people for the last 7 days. So that's probably going to continue for the next several weeks. We are going to be at 5 million cases this weekend in the US. That's a stunning number. We're still growing at 500,000 cases per week. There is a slowdown, but we have to see if this data reporting. Remember, California is the biggest number of cases, and they're having this huge problem in data reporting. So let's take a deeper dive on what's going on. So, whoops. Let me go back here. The US case have fell 5% in 1 week. It's around 180,000. If you remember, a few weeks ago, we are 200 to 250,000. But the testing has dropped, and the positive rate, depending on the source, is 7 to 8%. That means we're under testing. And therefore, we don't really know if the number of cases having dropped is because we're testing less, or if there's really a slowdown of the infection. The fact that we still have an 8% infection rate means that we still have an outbreak going on. But on paper, it looks like a lot of the states are much better than they were 1 or 2 weeks ago, where this was all red, if you remember. To get perspective, Florida, Texas, and California are kind of leading the charges in the number of cases. But you can see that we're growing still pretty fast. We're going from 4 to 5 million cases in 2 weeks. So we still have a pretty high growth rate. The number of deaths are up by 36%. Most of them are in the Sun Belt and the Midwest. Remember, there's 3 to 4 weeks delay from the time you have a rise in cases to the time you have the mortality. But you can really see in the graphic there that we're clearly going straight up. And there's certain area like Texas and unfortunately Washington and some of the north west area there where they've been growing at more than 50% in a period of a week. To get perspective, at times these numbers have no meaning. It's really hard to get excited by it because, what's 1,000, what's 1,000? Here's the perspective. During the Civil War, the death per day was 514. We're double the death rate that during the Civil War. If you look at World War II, they were around 297. So we're 3 times the death rate during World War II. I just want to sit there for a second there because I think we basically don't realize the magnitude of these numbers. We already passed the total number of people who died from World War I. We had 160 cases. So in the best case, if we were a perfect shape going back straight down, it would be 320. We know it's not perfect shape. It's a slow slope. So we may pass the number of people who died from World War II. I mean, these are astonishing numbers. The cost for the crisis, we spent $4 billion on an adjusted for inflation there for fighting the war in World War II. We already had 3.3 trillions, dollars there, which is more than the Iraq War, the Vietnam War, and the Korean War combined. So this is an event that's very significant there, and I think that it's not going to slow down for a while. Looking at the number of cases per week, Florida is number 1 on the 7-day average. If you look at the number of new cases, they're also number 1. So they're clearly leading the charge in the US. You can see a tiny bit of a slowdown, but there's some issue in Miami-Dade in the reporting of the data. In Texas and California, are pretty much tied in the number of cases per day. And so these 3 are really kind of driving the US. This map used to be all red and orange, which was the growth over a period of 2 weeks in the number of cases. And clearly, based on the data has been reported, we just went from high growth to slowing down, going downwards. I hope we can rely on the data, but that would be fantastic news if that continues. Some states are still increasing. You can look at Oklahoma, Nebraska, Puerto Rico, Illinois. are still on the upswing. Unfortunately, on the mortality side, there's many more states who are unfortunately on the increase. And remember that 3 to 4 weeks delay that we see when there's a rise in cases. The same hotspots. This is the graph I had 2 weeks ago. If you look at them, they pretty much look at this whole southeast and part of the western US. Looking over a period of 2 weeks to kind of show the growth. The good news is most of the southern and southeast and southwest state, I slowed down. There's still a pocket there in the central of the country. South Dakota, Nebraska, Kentucky, all of that are still on the rise, as well as Virginia. And then there's a bit of a swing in New Jersey and Connecticut, but it's still a small number there. There's something going on in Hawaii. Hawaii and Alaska are having a bit of a surge there, so I'm sure they're going to do some restriction. Some states are decreasing. Some of them are decreasing at a really high rate, which is really unusual that we haven't really seen in another country to have this peak as opposed to kind of a plateau and a slow curve going downward. So hopefully that gets confirmed in the coming weeks. The states that are flat, most of the states in the country there. The R0 is the ratio of how many person gets infected from somebody. So typically we want an R0 below 1 to stop a contagion to spread. And we were as high, a few weeks ago. You can see most of these were red. This is 2 weeks ago. So the good news, more and more of the states are around an R0 of 1. But again, this is based on the data, so we have to make sure it's accurate. Hawaii has a spike there. You can see on the right side. Just a reminder that if people would just wear a mask, we could drop the R0, which is started at 3.3, which was uncontrolled virus, to 0.9. So that's the most effective way right now to stop the contagious to spread. We're doing less testing. You can really see the drop in testing. There's been a massive slowdown since probably mid-July. And the number of positive tests as a result have kind of gone down a little bit there. So we want to make sure it's not the fact we do less testing that's driving the lower number of cases. We still have a very high positive rate of 7.4 to 8%, depending on the sources. And that's way above the 5% that we're trying to get at. This is an analysis that shows by the New York Times, are we doing enough testing? And overall, as a country, we have 8 states, which is the Northeast. We're meeting the targets in doing enough testing. But the rest of the country really is not doing that. And Alabama, Arizona, Mississippi, look at that. I mean, they're like 15% level of where they should be. The testing rate in Alabama, positive rate is 19 and 18 and 20%. These are wholly under-testing cases because we have such a high positive case. So what's happening in California? On paper, looks great. We basically have 538,000 cases, around 540. The death rate is going up a tiny bit. But starting July the 25th, they discovered they had a server outage, and they've not counted 300,000 lab tests. That's in backlog. In addition to that, they discovered that the data link that they had with Quest, Quest and LabCorp is the two biggest lab companies in the country there, had data certificate lapse, which means they could no longer collect the data. So you put this all together there, and then several counties decide to stop reporting because the thing wasn't working. So we don't really know. So I think this data is absolutely not reliable. And unfortunately, because California is the biggest country, the biggest state that has the highest amount, that has an impact on the overall US data. So just to be aware that it looks good, but we have to really know what the data is. So just a big flag here. The testing has gone down from 7.5 to 6.9% positive. But again, since we've underreported 300,000 cases, we'll have to see what happens next week when they clean that up. So right now, these are artificial numbers. Overall, it's still the same problem we've seen in the past, which is 60% of the positive cases are the young population between 18 to 49 years old who are spreading it. Most of them, half of them are asymptomatic, and that's what's spreading the disease. The Latino population is really affected. 58% of the population from the Latino are the positive case, which is significantly more than the mix in the population. And you can see the ratio between the Latino and the white population, which is totally a much lower number. part of that has nothing to do with ethnicity, is the social demographics, where the Hispanic population there has to go out and work. And we have a major outbreak in the Central Valley, which is probably because this is the time of the year that we are picking all the fruits and vegetables. And you have the Latino population who's going from places to place to do the picking, probably spreading the disease, unfortunately, there. California hospitalization, which I think is probably a stronger number, showing that we have plenty of capacity, but we still have an issue in the reporting of the data. So this thing going downwards may not be accurate. And you can see in the ICU bed, this is a massive drop here, which is clearly telling you something is wrong in the data. And again, I just spent some time in California because most of us live here, but we may have similar problems in other states. So data that we've watched in the past, the ratio between Imperial County, which is near the Mexican border, is around 5,000 cases per 100,000 residents. Compare this to Santa Clara, it's a ratio of 10x. So there's really different pockets. We cannot take the state as a whole. It's really Southern California that is having the problem, not Northern California. I've moved some of my business slides from the clinicals to this part of the presentation there. And this is to give you some relationship of the type of stimulus. This is the drop in GDP that's being expected. This is from COVID. And you can see that there's been a huge stimulus by all the different governments in really trying to re-energize their economy. And pretty much all those countries are expecting 20 to 25% drop of GDP, which is unheard of. It's bigger than the biggest recession, the Great Depression in the 30s. So we have to see how we get ourselves out of it. Now, how do you explain the stock market? The stock market has a history of going up 4 to 8 months before the GDP started rebounding. And so hopefully, historically, you look at the Eisenhower recession in the 50s and some of the stagflation there. I mean, there's all these data show that the stock market is anticipating the rebound of the GDP. Hopefully, that does explains why our stock market, if you have thing in the stock market, whoops, let me go back. You can see the stock market has gone straight back up, depending on the sector. And the technology, like the Amazon, Facebook, Staples, and all of that, they're up 13% since the beginning of the year. So they fully recovered and higher than where we started with. The one that being really hit is the retail industry, the financials, and the industrials who are depending on their plants to be open there. So this tale of two cities. But overall, the PE ratio, which is how much you're paying for the earnings, which on the average used to be around 15 times PE ratios, there is above where it used to be. So the market has fully recovered and is clearly anticipating a full recovery of the GDP. So we hope they're right. So to summarize on the epidemiology video, we need to really help the country to understand that we need to move from an individualist culture, which is the strength of America with entrepreneurship and creativity, to really put up some of inconvenience like wearing a mask so that we can have better personal responsibility to protect friends, family, small service businesses. A lot of restaurant business are going under. Allowing the school to reopen to be safe, allowing the mother to be able to go back to work, and hopefully get the economy back, because that's what everybody's anticipating. So thank you very much for listening to that first video. Please go look at the clinical insights. There's a lot of new information this week, and please post this to your friends.